Menopause is a recognised condition affecting middle-aged women. Now there's a new breed of doctors who believe men also suffer. Both Stan and John were diagnosed with the condition called andropause, which causes fatigue, depression, irritability and a reduced sex drive.
I actually considered suicide. I felt that if this was the best I was going to be for the rest of my life, then, well, forget it.
I was just lethargic and I didn't want to do anything. And, you know, it was an effort sort of to do a day's work.
But a Harley Street doctor says there's a simple way men can regain their lost youth and vigour. He says that thousands of men, both here and in Australia, are using his treatment and feeling 10 and in some cases even 20 years younger.
Very well. Come and have a chat.
Dr. Malcolm Carruthers has thrown a hand grenade at the establishment. He believes as men get older and their sex hormones decrease, they too go through the change of life. He prescribes a radical treatment.
I call it TRT, testosterone replacement therapy, for men, and I think it's the start of a whole exciting new era in men's health.
Dr. Carruthers says andropause can strike men as young as 35, but it typically starts in their 50s.
Some doctors would say, well, there's nothing wrong with you, but...
Believers say the condition is caused by lower than normal levels of testosterone, but opinion is divided as to what's normal and whether men should take testosterone supplements.
Whereas 30 years ago it was really considered heresy to prescribe hormones to ladies, now it's considered heresy not to.
Here in Australia, Dr. Lou Zaninovich leads the crusade. His Perth clinic, the first of several planned around the country, prescribes TRT for men like Stan Evans.
And then when I started treating with hormone replacement therapy, I could see that these symptoms were improving, whereas they weren't with other medications. So I think sort of became a bit of a convert.
Testosterone is a very powerful hormone and it's administered only under strict guidelines from the doctor. In Australia, it's prescribed in 3 forms: as capsules, as a series of injections, or as an implantable pellet, the effects of which last for up to 6 months. On the flip side of the debate, many doctors doubt andropause even exists.
Although people think testosterone is the major driving factor for sexual function, in actual fact that's probably not the case. You need a certain amount for things to function normally. Once you've got that amount, it's more dependent on what the brain's doing than what the testicle is doing.
Do you mean it's a psychological problem for some guys?
I think that probably is fair. I think that's probably right.
There are also some serious health concerns regarding TRT. It's established that if men with prostate cancer are given testosterone, their cancer grows more rapidly. But it's still not clear as to whether testosterone supplements can actually cause prostate cancer. So men having this therapy must be closely monitored by their doctors. While the medical arguments about andropause and TRT continue, John is back in the gym and his life is back in order.
A few pills a day and you wouldn't believe the difference it can make. It's quite amazing, it's remarkable.
For Stan and Mavis too, the bells are ringing again.
He's my husband back again. It's great. We're very grateful.
It could be really dangerous if I was 40 again.